Hi, Dr. Kalika here, and today we want to talk about proprioception and hip pain. And what you see here is a swivel chair. It's a special physiotherapeutic swivel chair, and it's connected to a gyroscope, which connects to the software, which we use for feedback. And oftentimes people with hip pain, low back pain, don't have proper proprioception, and they have no idea how much force they need to move how much force they need to move a particular body, or whether they move too much or too little. And this way of feedback is actually excellent. So what I'm going to demonstrate here is you can see the lumbar spine. She's a little extended here, and she's more or less in the neutral here. And if I ask you to bring the pelvis posterior, can you move the chair with it? And try to move the pelvis anterior. And sit a little bit back. And sit a little more. Hi guys, Dr. Kalika of NYDNRehab here. And today we want to talk about the pelvic stability and proprioception. So proprioception is a sensation that comes from joint, muscles, and fascia to your brain, and allows you to gauge how much muscle force, how much muscle recruitment, and which muscles, and in what way you're using. And oftentimes people, because we sit too much, we lose that. And people with back pain, hip pain, mid-back, low back pain, SI pain, lose that proprioception. So Kenzie is sitting on this special swivel chair that is connected to a gyroscope. It's a device that allows the software to know which way you're moving and displays that in real time. So we use this with feedback, so you can see it has gains. And if you swivel your pelvis, you can see how that board tilts, and she has to move the ball to get to the center. But before a patient goes and does that, we actually go through a discovery process. We want to know, does the patient know what it is to tilt the pelvis anterior and posterior, and how does he do it? Does he tilt the pelvis anterior by bringing the trunk forward, or she can isolate the pelvis on its own? And oftentimes people have no idea what to do with their pelvis and how to isolate pelvis. Same goes for the hip. And this is the sagittal plane. Frontal plane, when we walk, our pelvis have to laterally bend, and that movement involves hip, pelvis, and the thorax. And oftentimes when the hips are weak, the patient shifts the thorax to weight bear before shifts the pelvis. So there are a variety of these different movement patterns that we can retrain. And first we go on discovery, where I will examine. If you please lift your right knee and keep it off. And now, can you shift your torso together with your pelvis to the left and low? And you see how challenging it is. And now come back to neutral. And you see the way she got back, she tilted the pelvis, she didn't bring it together. So what I want you to do now is repeat again, is to move it together, so that this does not precede the pelvis. So kind of bring both towards me at the same time. Lift the right knee. And come towards me. So you come towards, move the pelvis. So she has to hike the pelvis at the same time as she moves this. And it's very challenging. Very challenging to see how much she struggles, and when she's on one leg. So this is a lot of weight shift. It's important for weight bearing. And this is one of the things we train. And now, can you tilt the pelvis? And you can see when she tilted the pelvis, she took the whole thorax with it. Okay? Now let's try again. Try to move the pelvis without moving this. And you can see that's all she's got. And there's a lot more. And we've been training this, but still she's missing some, because these kind of muscles, and you can see this rotator is a little glue in between these. So we have to train this. I bet she wouldn't have a problem to tilt the pelvis forward. Go ahead, more. That's nice. You see how much range she has into moving the forward, but she doesn't have enough range moving the backward. So that's another movement we train. We can also work on thorax rotation and hip movement here. So I find this setup is very simple yet very, very important, because people think the physical therapy is all about the strength. It's really not. And yes, there are times when we need to strengthen the strength training for the hips, but oftentimes it's all about putting the body together first. And now we're going to demonstrate how Kenzie can work on this game, and you will see itself the difficulties that this presents. Go ahead and try to leap that ball through the obstacles, and try to go very slow, extremely slow. It's very hard to move it very slow, because if you see that the ball is moving fast, then the movements are jerky, and that means that she doesn't have the synergy. So if you would see her face, she's concentrating so much and breathing very hard. And that's without any correction. On top of that, we use different corrections, and we try to give her feedback, tactile feedback, and oftentimes we use ultrasound machine to see what happens inside. So this kind of proprioceptive feedback is amazing for hips, pelvis, and low back. Thank you very much. So now we're actually going to ask Kenzie exactly what she feels, or what she feels challenging, how her body moves, and see what she feels when she's on the chair. So what exactly do you feel when we're trying to correct you?
Well, there's definitely a learning curve to moving my pelvis, for example, with the chair. They don't necessarily work in tandem until you choose to and learn how to do it together. My core is definitely working a lot, and because you can change the sensitivity, you can go from, focusing on the tiny movements and the control to, finding more of that alignment and the resistance.
So all in all, there's a variety of things we do, and once she progresses and she feels that she's better with that movement, we go to the next stage. So this is a way to discover proprioception, discover core coordination, because every patient who does that says that this is more challenging to use the core than it is to do core strengthening. And she's shaking her head, and it's a fantastic way to progress patients.